let's jump into the specifics here. Remember, it takes a team to generate the data that we're showing here. So Lacey and Andy, feel free, or Michelle, feel free to jump in for any clarifications. But let's have this first slide, which really shows us our cases. And what you're seeing here is a downward turn in our number of cases. We are hearing from a lot of our folks in the field that are doing most of the testing that they are clearly seeing this. I know in my own clinic, we are really seeing a dramatic decrease in the number of people being tested and the number of positives, as evidenced by this. Reminder that these gray bars to the right are incomplete data. They can go up, but it appears to be the trend is going down at this point. So this is what I affectionately call light at the end of the tunnel. Of course, Lacey always reminds me the light at that end of the tunnel could be a train coming. So we'll reserve some comments here, but it is all very promising. We don't see any evidence of a new variant or increase in cases coming. So I don't think it's a train at the end of the tunnel. I think it is truly a downward incidence of our cases. So with the next slide, you saw this earlier. Go on to the next slide. This is the hospitalizations. It's not, hospitalizations usually follow about a week behind any of our cases. So we're not seeing this downward trend yet in hospitalizations, but again, this is what looks to be a stalling out of our hospitalizations. This is also very good news. And the caveat to this, of course, you guys, is that Western Washington is different than Eastern Washington in both our cases and our hospitalizations. And when we look at these numbers, these are the state as a whole. So we will likely see a lag in Eastern Washington in the decrease in cases and hospitalizations, and it'll make the overall rate in the state look like it's going down slower. But this is promising. So next slide. What is of concern, but not totally unexpected? At the end of this, what we call these are epi curves. At the end of this epi curve, we see an increase in the number of deaths. And that's not unexpected with the volume of cases that we're seeing, but the death rate does not appear to be as high as with the other variants. But I'm concerned that we are in this gray area going to see quite a few more deaths still reported. So to everyone who is saying, hey, look, it's great, it's getting better, it's not a big issue, we're having between 50 and 70 deaths per day. So this is still a very significant pandemic at this point. It's just got some signs of it going down. So next slide. And again, what's holding true, this isn't opinion or science. This is what we're actually observing here in Washington State, that the hospitalization rates for those who are unvaccinated during this Omicron are 5 times higher for those in the 12 to 34 age group, 7 times higher in the 35 to 64-year-old, and 8 times higher in the 65. This is the observations that really drive our biggest recommendation, that your best protection against hospitalization and severe disease, even from this more infectious Omicron, is to get vaccinated and boosted. Next slide. And here it is graphically. You guys are seeing this. This is the case rates in those 65. The lower lines are the fully vaccinated or partially vaccinated versus the red line, which is unvaccinated. And that's a 5 times difference. I think if we were to tell people you had a 5-time risk of getting in a car accident, you probably wouldn't get in your car. So don't get in your car without getting vaccinated here. Next slide. And this is the hospitalization rates, 8 times higher. Go ahead to the next slide. And here we are, the death rates. Now it's very hard to calculate death rates in the younger age groups because the volume or the number is so small. But in these where most of the deaths are occurring, in these 65 and olders, you're 9 times more likely to die if you're unvaccinated. So that is a very significant observation here in Washington State. Next slide. And we'll switch over to Michelle here in a minute to talk about vaccines. But the last thing I want to leave you with is 100% of all our variants at this point. We still have a very robust genotyping program. 100% of our variants are still the Omicron. I know there's a lot of question about a sub-variant of Omicron. It is the same virus. It is the same variant. It's just a twist on that. We are not seeing a lot of these, nor are we really getting into the reporting of these every day, because clinically it has not been proven to be any difference. This is the same Omicron variant that we've seen the whole time, and that's 100% of what we're seeing. I am hoping, and I am hearing some preliminaries, that clinics are starting to decompress a little bit, and some of our hospitals are getting a little more breathing room as these case rates and hospitalizations go down. I think, though, as a state, we're into this together, and we're really going to have to lend a helping hand to Eastern Washington to help them get through the hump as we have in Western Washington.